So the first case which I will be discussing today is about my patient Sadia. So Sadia was married for 7 years when she came to me, and she had a beautiful baby daughter who was 5 years old. And the main reason why she came to me was that she was not able to conceive for the last 5 years. The other main issue was that her husband used to come and live with her only for a couple of months every year. And every year he used to come and she used to try. Despite taking medications and despite being to different doctors, she was not able to conceive. So this time she chose me for some reason, and she came to me with this problem that, she was very, very desperate, that her husband was here for only a month now and she really, really wanted to conceive. So we started on with fertility treatment with Sadia. So the way I treated her was I gave her some fertility medications, and then we gave a course of medications during the period cycle, which with the main purpose of increasing the development of eggs in her ovaries. So since her husband was only there for a month, so I gave her a course of tablets followed by injections to increase the production of eggs in the ovaries. And after that, I called Sadia for a follicle scan, which is usually done around 12th or 13th day of the period cycle. So when I saw her on the 13th day of the period cycle, she had very good mature follicles present in both of her ovaries. She had an 18 millimeter follicle in the right ovary, a 17 millimeter follicle in the right ovary, a 20 millimeter follicle in the left ovary, and another 21 millimeter follicle in the left ovary. So she had beautiful follicles which had developed in both the ovaries, and the internal lining of the uterus, which we call the endometrium, that was also about 8 millimeters thick. So she was just in the ideal position to conceive. I did educate Sadia that there was a risk of multiple pregnancy, but she was very desperate for a pregnancy and she just wanted me to try my best. Even if she did end up with multiple pregnancy, she said that she would be more than happy to have multiple pregnancy as well. So, after checking the size of her follicles, I gave her the trigger shot of HCG. And the main purpose of the trigger shot is that it makes the follicles release from the ovaries. So on the 13th day of the period cycle, I gave her the trigger shot, and then I asked her to avail the fertile days with her husband. And what happened? 15 days later, she did a urine pregnancy test, which was strongly positive, and then she came to the clinic a few days after that. So when Sadia came to the clinic, to my surprise, what I could see on the ultrasound was 4 sacs instead of 1. So she had become pregnant, yes, but she had become pregnant with four pregnancies at the same time. So that is something which we call a quadruplet pregnancy. It was a bit of a surprise for me, and it was a big surprise for Sadia as well. She was over the moon. She was extremely happy. I called her back about 15 days later, and guess what? There was a baby in each of the sacs. So it was a confirmed quadruplet pregnancy with 4 babies in 4 different sacs, and each baby having a heartbeat. So Sadia was of course very excited. I was happy for her, but I was at the same time very tense as well, since quadruplet pregnancies carries a lot of risks, and I knew that I, being her treating clinician, will have to take care of all the risks, and I have to take care of Sadia. So from there on, the pregnancy started. So first we dealt with lots of nausea and vomiting in the first trimester of pregnancy, since it was a multiple pregnancy. So her symptoms were multiple times. Then what came the second trimester. In the second trimester, she started having really bad period-like cramps, and the pain was not tolerable. And I ended up putting a cerclage, what we call a stitch, on her cervix. So that was meant to give the cervix some support to alleviate her pain and to support the pregnancy. Sadia did extremely well in the second trimester with no major complaints, and then we entered into the third trimester. From entering the third trimester, whenever she came to the clinic from about 28 weeks, she looked as if she was pregnant like at 40 weeks. And she was extremely uncomfortable with the distension, and she had she had a lot of difficulty in breathing. She did have low HB, low iron, and she ended up getting iron drips. But overall, she managed okay. And we did carry on her pregnancy up until 35 weeks. And just a couple of days ago, I did her cesarean section, and we delivered 4 healthy babies, out of which 3 were baby girls and 4th was a baby boy. So the weight of the babies was ranging from about 1.8 kgs to 2.2 kgs. All the babies were healthy. They were admitted to a nursery for a night, and the next day all the 4 babies were with Sadia. I was lucky enough to get a picture with all the 4 babies, and the next day with the patient as well. The next day the patient was fit and healthy. She was walking about, eating, and she felt really well. After a couple of days stay in the hospital, she was discharged home uneventfully, and so were the babies. Currently, Sadia is mother of 5 babies now, a 5-year-old daughter and 4 newborn babies, and she's enjoying her mother. If you like my video, you can like my YouTube channel and subscribe my channel and share my video. If you want me to make video on any specific topic, you can also write in the comments. Thank you.